Hey everyone, this is an old episode that I am re-releasing, so I'm trying to make it slightly better quality. So if you haven't seen it, then that's great, but if you have seen it, then it won't be too long before a new episode is coming out. This episode is about the shape of some people's heads. I woke up from a migraine with the memory of going to discuss cranial enlargement. So in my dream of Tantal, or otherwise known as Atlantis, cranial enlargement was considered a good thing. This is because it relieved the people of the pain that they were having with their brain or head. I can't say exactly what the pain was all about, but it had something to do with the fact that once we took the aging cure, there was some kind of issue for most people with the brain after about 300 years. This was a particularly strange dream, mainly because of the shape of some of the people's heads. The ability to deform the cranium was discovered by accident. The accident occurred when people were taking a combination of the youth or aging drug with a fertility drug used when the individual wanted to ensure they got pregnant. It should be noted at this point that they were supposed to cease taking the aging drug when they wanted to have children, but that really is another story. So in a nutshell, the combination of drugs enabled the sutures of the cranium to soften and grow more cartilage, thus enabling the bones in the head to expand. This was considered advantageous in order to allow expansion. It was, over time, decided this was not only medically beneficial, but also very beautiful. There was no way to control the resultant shape, however. So when this technique was employed, they would have no idea how it would turn out because some cranial sutures would soften more than others. The most common resultant shape was mildly conical, but some people actually developed a strangely heart-shaped head. This occurred when the cranium became wider at the back. Most people, like my daughter and I, did it, but only to a mild level. Some people, however, were a bit more enthusiastic about it than others. So in the dream, we are going to the University of Medical Studies. So that's pretty much the equivalent of a hospital today. The place has only a slight feeling of being a hospital. It was more like a luxury hotel, but without private rooms. Hard to explain, really, but the people were not grouped by illness. It was just a case of being allocated a space when you turned up. If you needed a procedure, it was done there and then, with very little time to wait. So whether you were turning up because you stubbed your toe and it went black and swelled up, or if you'd accidentally been struck in the chest by a cloak pole, or even if you wanted a cosmetic procedure. Actually, most cosmetic procedures did not last that long because of the longevity drug. But anyway, that's another issue. Because the longevity drug essentially enabled the body to keep repairing itself according to the DNA plan for your body. Hence, some cosmetic procedures, well, after a few years, they were no longer there. But anyway, I deviate. So as I was saying, you turn up and you get allocated a space, and that space is open plan, but it has all the beds around the walls. The beds have one side against the wall. The wall holds all the things that the patient needs on it. The bed can be swiveled so it sticks out from the wall, so that the head is against the wall and the feet are sticking out. But that's only when there's things to be done like changing the bed or doing something to or for the patient. The rest of the time, the bed and the patient is hard against the wall. The room has an area in the centre where the medical people are located. They are in the room with the patients, and the patients can all see the staff, and vice versa. I'm going to deviate again just briefly because the linen on the beds is quite interesting and quite different to today, as the sheets are more like a loose loop or maybe more like a sock. So it's like pulling on a sock, then another sock on top of that sock. So, when they're making the bed, they put the base sock on first. The patient goes into the bed, and then they pull the upper sock onto the bed. Then the bed gets swiveled back to being against the wall, and there you have your patient in the bed. I never saw that sort of sheet anywhere else. I think it was just a hospital thing. Anyway, back to the skulls. So if you see in a museum a weird-shaped skull, it might be from a person from Tantal, or it might only be a normal person whose culture so loved someone who had been of Tantal that they tried to copy the weird head shape by binding the heads of their babies. Now let's get serious here. How could anyone or any culture come up with an idea so weird of changing the shape of the skull just out of thin air? They must have got the idea from somewhere. So how can you tell if a skull was an ordinary person's skull, whose head had been bound as a baby, versus a person from Tantal? Well, that's pretty easy. It's cranial capacity. If the head is just a funny shape, but essentially the same size as a normal skull, then it's just a normal skull. I know, I struggle to stay on topic, but I do get there in the end. So for each dream I have, there are so many aspects that I feel I need to point out. I hope you forgive me for all these deviations I take along the way. So thank you for listening, and I will catch you all in the next episode. Bye.